Hello. Today we're going to talk about postoperative bleeding and hemophilia. This is something which we hopefully will be having only rarely, but because we do admit our patients after surgery, even for minor surgeries, it's important for you to understand what to look for overnight when you have to take care of these patients. Evaluation of bleeding with hemophilia depends primarily on recognizing that all patients who have surgery have a risk of bleeding, and this bleeding can be minor at the level of a normal person, or it can be fairly problematic. One of the key tips to caring for these patients is when they get to the floor and you're doing your H&P or you're doing your admission note, talk to the surgical resident or talk to the attending and find out how much bleeding they would expect to see in a normal child. And that will give you an idea of what kind of bleeding you would expect to see in a hemophilic who's properly managed. Bleeding in hemophilia rarely gushes, so this is not going to be a dramatic event. This is going to be a slow oozing of bleeding, and so don't be lulled into a false security because of only a small amount of bleeding, because a small amount of bleeding over a long period of time can become a real problem. Bleeding in hemophilia also tends to form masses or hematomas, and these hematomas by themselves, by their mere presence, can cause problems. One of the hot areas of hemophilia, one of the real concern areas, is the upper airway. And this occurs from either the use of mandibular blocks for wisdom tooth removal or other kinds of oral surgery, or airway manipulation, for example, an endotracheal tube. Hematomas form at the injection site or form where the airway may have been injured by intubation, and then those hematomas track backwards into the soft tissue around the upper airway. As you note from this diagram, much of the upper airway in the anterior and lateral portions is soft, and a lot of potential space exists. And if you think about the epiglottis, you can have a significant amount of swelling of epiglottis, as you know from epiglottitis discussions. And so airway compromise is our big concern. And so whenever someone's had oral procedures, whenever someone's had to be intubated, particularly if they've had to be intubated on an emergent basis, constant monitoring of oxygen saturation, constant monitoring of their upper airway, and their respiratory effort to breathe is of critical importance in terms of monitoring these patients. Here are a couple of examples of other kinds of oral bleeding. The liver clot you see on your bottom right is a clot that forms frequently when a child loses a tooth and is not treated. And this is called a liver clot because it looks like a little piece of liver, as you can see on the screen. Lip and tongue frenulum are also seen commonly as a site of bleeding. And while these can be dramatic and they can be painful and they can be scary, they're rarely of significance in terms of a risk to the child's health, and they can be treated with local control or clotting factor if needed. Bleeding into the ankle is an example of a joint bleed, which may promote or progress after surgery. And you note this x-ray on the right with the red arrows, you see the fat stripe, which relates to having fluid in the joint space, in this case blood. And then here on the left you see the child's ankle, and you note it's swelling. You note that he has it in a relative plantar flexion that increases the joint space in the ankle, so bleeding can occur there. Other signs of joint bleeding include a bubbling sensation or tingling sensation, and this is commonly seen prior to pain. So someone might complain of having a bubbling or odd sensation in their joint and be suspicious for bleeding in that joint. Swelling, stiffness, and pain obviously are a possibility as well. In the soft tissue, in addition to swelling and pain, dropping hemoglobin is really important, particularly in the large muscle groups such as the psoas muscle or the muscles in the quads or the thigh, hip girdle. It's possible to lose a large amount of blood even with a simple and uncomplicated bleeding event. And of course, we've talked about obstruction of function type hematomas. And again, worry about that airway. Always be paranoid about that. So how do we treat our hemophilics? A mild hemophilic would typically be treated with DDVP, which increases the amount of factor VIII in the plasma, pre-op, and then be given Amicar IV or orally. If you're going to use oral Amicar, please remember to use the liquid Amicar, as the pill form is difficult even for adult patients to get down. Factor VIII can sometimes be needed as well. Moderate and severe hemophilics are usually treated with a bolus of factor, followed by a continuous infusion to account for metabolic losses. Amicar can be used particularly in an oropharyngeal bleeding event, such as a tonsillectomy. Factor VIII raises your clotting factor 2% for every 1% per kilo you infuse. So 50 units per kilo raises your clotting factor to 100%. Factor IX, 1 unit per kilo, only raises your factor level in the plasma by 1%. An important thing to remember about monitoring studies is while a PTT may well normalize, it normalizes at around 30%. So somebody may well have a deficiency of clotting factor and have a normal PTT. Once you have a low PTT or abnormal PTT, you don't know how low the factor is. So you may as well go ahead and do a factor level directly. Okay, so some of the complications we deal with. One is commonly we'll have a factor level that's too low, and we'll end up having to bolus that patient prior to adjusting their infusion rate and then adjusting their factor doses and stuff based on their factor level. Inhibitor antibodies can be uncovered in these patients. They're not common, but when they do occur, they can become quite a problem. And my advice is then you call for hematology consult even in the middle of the night. If a person's clotting factors are not coming back to normal and you've bolused them and they're still not normal, then you have to just go ahead and call us. Okay. Thanks. If you have any questions, please give me an email. Bye.